So now let's talk about how to manage your kidney disease, both you and I together. So our goal is to keep your kidneys as healthy as possible and to keep your eGFR as stable as possible to prevent it from getting worse, or preventing CKD progression, as we like to say. The way to do this really depends on the cause of your kidney disease and at what stage it is right now. While there can be many causes of kidney disease, the two main ones in the United States are diabetes and high blood pressure. And so it's really important that we work together to try to control your high blood pressure and control the diabetes, which also helps control the kidney disease and prevent it from getting worse. Okay?
Okay.
So if somebody asked you what were the two main causes of kidney disease in the United States, how would you answer that?
High blood pressure and diabetes are the
Exactly.
main causes.
Exactly, yeah. And I just harp on that because it's really important that we realize that while I'm very nephrocentric and I care about your kidneys, it's also important to realize that your kidneys are part of the larger cardiovascular system in the body. And so making sure that your blood pressure is good, which helps the heart, also helps the kidney. Okay, that's why I harp on it quite a bit.
Okay.
So other things that we can do to try to keep your kidneys as healthy as possible include a healthy diet, as well as physical activity to keep your weight nice and healthy, and making sure that your medications are safe for you when you have kidney disease. So when talking about diet, there are a lot of people that have questions about diet with relation to kidney disease, and I think it's a really important question. In general, I recommend a low-salt diet. This not only is helpful for blood pressure, because additional salt can increase your blood pressure, but it's also helpful to decrease the additional burden or the additional weight that the kidneys have to work with. Okay, so a low-salt diet is really important. And I also recommend that individuals with kidney disease see a nutritionist, because they're going to be able to help you devise an individual treatment plan or an individual diet plan that is great for you at your level of kidney function. Individuals with mild or moderate kidney disease don't need to necessarily have the same diet restrictions as individuals with more severe kidney disease. Does that make sense?
And will you refer me to a nutritionist?
Yes, exactly. So yes, I will go ahead and refer you to a nutritionist. And I think after you go see that individual, he or she can let me know what they recommended to you. And it'll be important to keep that communication going.
Great.
Okay? So in addition to diet, physical activity is super important. And that doesn't mean you have to run a marathon every day. It just means getting more activity. Okay? That may mean walking, that may mean swimming, that may mean running around with your kids. All of that is super helpful. It's just additional activity. Helpful not only for your heart, but also for your kidneys. Okay?
Sounds good.
And the last thing I wanted to harp on or talk about are medications. You know, we prescribe a lot of medications that are really important for a variety of illnesses, including high blood pressure and diabetes, but all of those medications could also have an impact on the kidney. So it's really important that whenever you have a new medication prescribed for you, or you pick up a new medication from the pharmacy, that you ask whether it's safe for you to take with your kidney function in you having chronic kidney disease. Okay?
Okay.
And I'm talking about medications that are prescribed, as well as medications that you might pick up over the counter. You'd be really surprised. Common things such as what we call NSAIDs, non-steroidal anti-inflammatory drugs. So those are pain medications such as ibuprofen, Motrin, Aleve. I'm sure you've taken some of those in the past. So those are really helpful for pain, but they can actually cause kidney damage. So again, it's really important that any new medication over the counter or prescription that you let your pharmacist know, or ask the pharmacist or ask your clinician whether it's safe for you with kidney disease. Okay?
Okay.
So I just went through a lot of information about how you can help keep your kidneys healthy. To make sure that I explained it in a way that was clear, can you just repeat back to me some of the most important points that you'll take home with you?
So you really underscore the importance of a healthy diet and working together with a nutritionist
Exactly.
to make sure my diet is in line with where I'm at with my kidney disease. You suggested just increasing activity, not necessarily running a marathon, but just increasing physical activity. And lastly, you just asked that if there are any new medications prescribed to me, that I would make sure that they are not going to cause further kidney damage by running it by a pharmacist or by you.
Excellent. That's perfect. Two additional things that I would want to mention is that smoking can be really harmful for your heart, as you know, but can also be harmful for the kidneys. So stopping smoking is of particular importance. And if you need some help with stopping smoking, I can make a referral for a variety of different ways or medications to help you stop, patch, gum, etc. And the second important thing, I emphasized a lot about medications, but herbal supplements. I don't know if do you use herbal supplements at all?
I take vitamins
Okay.
over the counter.
Okay, and where do you get those vitamins usually?
Online.
Online. Okay, so one important thing is the next time you go to your doctor's office or you come see me, it would be great if you could bring all of those medications and those vitamins with you so that we can take a look at it. A lot of herbal supplements are safe and can be healthy for you, but there are many that can actually interact with your other medications or can cause the kidneys some harm. So it's really important that I just take a look at them and make sure that they are safe.
Sure
Okay?
thing.
Excellent. So these are the treatment strategies that I mention the most when chatting with patients with kidney disease. That includes diet, and I really emphasize the importance of a referral to a dietitian or a nutritionist in order for the patient to have an individualized diet plan. And oftentimes that referral can be covered by insurance or Medicare. Other important items, I discuss physical activity, as you saw, and really emphasize the importance of medications. I think medication safety is something that resonates really well with patients and is also of extreme importance. Not only medications that are prescribed, also over-the-counter medications, as I mentioned, and herbal supplements. So just to recap, today we talked about the roles of the kidney in the body, what is kidney disease and the different stages. We talked about ways to manage your kidney disease over time. And now the last few things I wanted to mention is how important it is, now that you know that you have kidney disease, to disclose that to all of your other clinicians and all of your other doctors. It's important that they know you have kidney disease, not only because of the medications that they may prescribe, which we talked about earlier, how some of those medications can harm the kidneys, but also some of the diagnostic tests that they may order, things like CT scans or CAT scans with contrast dye. Contrast dye can be really helpful to see what's going on in the kidney and to see the blood vessels in the kidney, but it can also cause some kidney damage, either acutely, transient kidney damage that gets better over time, or it can cause kidney damage that is irreversible. So that's why I'm harping on that a little bit now. It's important that you let your other doctors know that you do have kidney disease so that they keep that in mind when those tests are being prescribed. Okay?
Okay.
So just to make sure that I was clear with my explanations, can you describe to me how you would talk to another doctor about your kidney disease?
Sure. So now that I have been diagnosed with kidney disease, I want to make sure all my other providers are aware of this diagnosis, just in case they would order a test for me that would involve some sort of dye that could harm my kidneys.
Exactly. And any medication that's prescribed to you.
Gotcha.
Perfect.